It is my immense pleasure to introduce World Federation Neurology viewers through our YouTube channel and World Brain Day page to one of the rising stars in multiple sclerosis and neuroimmunology from beautiful Bangkok, Thailand. Sasitorn, very good morning to you. Thank you for giving us time during your busy schedule. How are you?
Hi, how are you? My name is Dr. Sasitorn Siritho. I'm from Bangkok, Thailand. I'm a MS specialist and also I do general neurology in Thailand.
Tell us about your school days and medical school days and your journey towards a neurologist, Sasitorn. How did that become?
Okay, I start my bachelor degree of doctor at Sirat Hospital, Mahidol University, and I got diploma of Thai board internal medicine and carry on my career in clinical and research stroke fellowship at Austin Medical Center, University of Melbourne, Australia.
So you work with Richard McDonnell and the Jeff Donnan, Helen Dewey. They're probably familiar names to you.
Yes,
they're great people. So you had a good time in Melbourne.
Yes, I traveled a lot.
Right.
During 2001 and 2003.
Mm-hmm.
And then I have a time at Alzheimer's Center, UCLA, for a month as a visiting fellow in 2004.
Mm-hmm.
And then I back to my country and complete my Thai neurology board in June 2005. And then I carry on my study again, this time in multiple sclerosis fellowship program at the Ottawa Hospital, Ottawa, Canada, in 2007 and 8, and then back to my country again and start my work.
So what made you interested in neuroimmunology and multiple sclerosis? Is that something that you became interested in during your neurology training in Thailand or Melbourne or much earlier than that? What sparked your interest in multiple sclerosis?
I think it started at my university just back then, and because in Thailand at that time MS is not familiar disease. So when I faced my first patient, I could not think what can I do for them, and I want to learn more and try to help my patient. If I know in deep knowledge, I think I can help them better.
Sasitorn, as you are well aware, the World Federation Neurology and Multiple Sclerosis International Federation, the joining together for this historic World Brain Day that is on at this point of time, and the day is 22nd of July, but we plan to continue the campaign advocating for better access, better care for multiple sclerosis globally. How excited are you as a specialist physician, neurologist interested in multiple sclerosis from Asia, Oceania region to see that this is happening for the first time in the world?
Yeah, I think it's very interesting because MS and other related disorder is not is under recognized as I'm a neurologist, especially in this region, because it's one of the rare disease, if we can call that, in Thailand. So even general neurologists, they don't have experience on that much. So this is the first time that you widen the awareness to all of the physicians, especially for neurologists. Somehow symptom can related to other general physician as well, even not neurologists. So I think this is the time that we can expand our knowledge and awareness to the public and also practitioner.
Indeed, in fact, you and your colleagues can visit World Federation Neurology World Brain Day website, download the toolbox. You are more than welcome to translate them to any Thai dialect or Thai language and use them as they belong to them. We also offer intermittent press releases that can be translated to your language and then use your title and institution details, society detail, and then send it to local media so that you can talk to Thai television, newspapers, this and that with the same idea. Tell us about the situation in Thailand. As you know, at this point of time, we probably have close to 3 million people with multiple sclerosis worldwide, 2.8 million to be precise, looking through the Multiple Sclerosis Atlas third volume. What's the sort of a situation in Thailand? What are the pressing things that you face when you try and offer best treatment for your patients? Is it underdiagnosis that you mentioned, or lack of neurologists interested in multiple sclerosis, or access to treatment, or all of the above?
I think all of the above. Mm-hmm. So I have an opportunity to work with the MSIF by interview that they collect the data from Thailand, also the earliest version. So the prevalence of MS in Asia is low than the Western left, for sure. And in Thailand, we never have national survey, but based on our multi-center study from 3 major centers of MS, we in 2012 we identify only like 400 patients with definite MS. For now, 2021, I guess the approximately like 1,000 to 12,000 you have definite MS, and that's one problem. The prevalence is low in Thailand, same as other Asian country. The second one, we have a great mimicker of MS, NMOSD, which is higher prevalent here. So the second problem is diagnostic problem. In the past, we faced problem about the accessibility of diagnostic tool, which is AQP4 antibody. Now, I think we have much better than before. We have 6 centers that can test for AQP4 antibody and also with anti-MOC antibody. So that solve a lot of problem in diagnostic problem. And
this would be a very useful information for the rest of the other countries in Asia, especially low to middle income countries such as Nepal, Bangladesh, Sri Lanka, Bhutan, etc. What was the process of establishing ability to do these antibodies against neuromyelitis optica spectrum type disorders? Did it take a lot of years of advocacy and training and getting those trained experts back? What was the story of the building those capabilities or capacity in 6 centers in Thailand?
At the first beginning, luckily we have one neurologist back from Mayo, and he worked at Prasad Institute, which is one of the big hospital in Thailand, in Bangkok also. He founded the lab for AQP4 testing, used the technique from Mayo, and that was in 2012, I guess. And after that, I asked my boss Dr. Friedman from Canada. How can I introduce someone from the Euroimmune? And he gave me some information. So I wrote an email and invite the person that can do the things to
anti-MOG
meet,
antibodies.
Yes, anti-MOG and ATP4, and ask them to see someone, the authority that can do lab setting.
So basically, you made connections with overseas experts and then send local people to learn the technology and bring the reagents and then start the process in one center, then two centers. At the moment, there are 6 centers in Thailand, which has the capability to do them. So the message that we wanted to share with the rest of the other parts of the world is it is all in education and training, isn't it? Yes, there's some money involved, but if there is a doer, or if there is a visionary person who really wanted to establish these techniques in their own countries, although it is a hard process, it is not impossible. Because nowadays, one thing that we learn out of this pandemic is how easy for us to connect with each other. And I'm talking to you from the very cold Melbourne today to the probably very warm Bangkok, using the technology of internet and sharing information. And this would then be available for the whole world, even when both of us are gone from this planet on World Wide Web through World Federation Neurology. So that's a great story. Finally, Sasitorn, I know that you got a busy day ahead. I got a busy day ahead also. What is your final message to young neurologist trainees and medical students anywhere in the world? Why do you think that they should choose a long-term career in neurology rather than anything else?
I think neurology is not just neurologists. Now we have more knowledge about basic science and how to use basic science from bench to our clinical practice, and also is subcategorized into multiple subspecialties like movement disorder, neuroimmunology, stroke, and like neuromuscular disease like that. So in each area, they also have many things that you can carry on in your career. Like in neuroimmunology, we have not only MS, we have MS-related disorder and then paraneoplastic syndrome. And then we will find another neuroimmunology that's more specific and give many things to learn more. And it's very exciting moment at this time, I guess, because we have overwhelm of drug availability, but it depends on how can you assess the drug, assess the diagnostic tool, and you need to apply what you have now to your patient as better as you can.
And also, I think you are very correct. The neuroinflammation is so important. In the middle of COVID-19 pandemic, we both know very well there are more stories to be told. The long COVID, which our group has described as post-COVID-19 neurological syndrome, is probably here to stay. Probably 30 to 40% of the COVID-19 the patients or affected people might develop these symptoms in time to come. And neuroinflammation is probably going to be the key to unentangle those mysteries and find solutions. So the young people would definitely have illustrious careers and rewarding careers. And at the end of the day, our brains basically make us who we are. Without our brains, we are basically nothing. So if you are a physician taking care of brain disorders and promoting brain health, that must be the most rewarding job anywhere in the world. Sasitorn, before we go, tell us about your life outside work. Are you happy to share some of your personal information? What do you like to do when you are not reading about multiple sclerosis or aquaporin antibodies or anti-MOG antibodies or post-COVID-19 neurological issues? How do you pass time during your busy schedule? How do you manage your work-life balance?
I try to do other than my work, but usually it's work related, like a research. But we can do something like giving knowledge and participate with your residency training more. So you can give them experience what you have met so far in the past and trying to tell them that you should balance your work and your life. And I have a little garden in my house, so I can sit there and have my leisure time there.
So you smell roses and plant trees and things like that in the garden. You were born and bred in Bangkok, or you were born elsewhere and then came to Bangkok later on?
Yeah, I born elsewhere, but it's not far from Bangkok.
Right. Thailand is a beautiful place. I'm sure the viewers of this video would be itching to come and visit beautiful Thailand once this COVID pandemic is under some sort of a control, which is probably some time away from us. Stay safe and stay well, Sasitorn, and all the very best with all your endeavors. And I know that you are doing some terrific work in Thailand and also in association with PACTRIMS also. Your colleagues speak very highly of you, including my own president, Bill Carroll. So he sends his regards also. All the very best and good luck. And we look forward to hearing from you more during the World Brain Day campaign, and post us your photos, post us your teams, your patients, colleagues, videos, and the World Federation Neurology publications, World Neurology, e-Neurological Sciences. We are always open for colleagues to submit their work on advocacy, as it is critically important. Thank you so much.
Thank you. Thank you so much.